Well, welcome to our video about endoscopic sleeve gastroplasty. Lots of people call this procedure ESG. This is a procedure that has a name like laparoscopic sleeve gastrectomy or vertical sleeve gastrectomy, a procedure that's been done in our country for about 15 years and is the most popular weight loss procedure that we do surgically. Things have advanced over the past 8 years, and now we're happy to offer this procedure that can be done through the mouth at endoscopy. Now you might think, wow, how powerful can that be? And it's not quite as powerful as a surgical sleeve gastrectomy, but it's close and safer. So we intend this procedure for patients who are on the lower spectrum of weight, body mass index of 30 to 40. The procedure is done under general anesthesia, but in the endoscopy suite, not in the main operating room. During the procedure, we're going to put an advanced instrument through the mouth, directly visualize sewing the stomach smaller in packets going from the last part of the stomach to the upper stomach. At the end of the procedure, the stomach looks like a sleeve gastrectomy, only we have not removed 80% of the stomach. Now, removing the stomach in vertical sleeve gastrectomy has some benefit and adds some strength to the operation. So an ESG, not quite as strong. The patient can expect to lose about 20% of their total body weight. For lower body mass index patients, those with a body mass index of 30 to 40, where we intend this procedure, that can equate to losing about 60% of their extra weight. So going from an unhealthy weight to something that's much more manageable. The weight loss occurs over about 9 months. Patients will need to be out of work for 5 to 7 days. It's still a procedure that's associated with some side effects, and you'll want to manage yourself at home for 5 to 7 days until you're very comfortable being back at work. The procedure is much safer than some surgical procedures with an overall complication rate of about 2%. Most of those complications are managed without a surgical intervention. So you might say, in this scenario, why would I want to have an ESG performed? Well, it's a permanent procedure. Some people have done very well with the new medications that are on the market and may have even lost as much weight as we intend for people to lose with ESG. However, ultimately, when people stop those medications, that weight comes right back, and that was seen in all of the studies of these medications. The ESG is a permanent procedure, and we have excellent data from both a randomized controlled trial that the weight loss is durable to 2 years and several American series where the weight loss is durable to 5 years. So we think of it as permanent without needing to take additional medications or shots over that time period. Now you might ask, who's not a candidate for this really exciting procedure? Well, we do intend to limit the procedure to body mass index between 30 and 40. That's where it seems to work best and have its most effectiveness. In addition, if a patient has had a surgery on the stomach organ itself, that's generally a contraindication to an ESG. And large hiatal hernias also can be difficult to deal with ESG, so we need to know that in advance. But by and large, the vast majority of patients with a body mass index between 30 and 40 are a candidate for this procedure. After the recovery period of the procedure, which is again about 7 to 14 days, you can expect to be very full with a much smaller meal. These meal volumes can go down to as low as maybe half a cup of solid food. Yet you'll be satisfied and your hunger will be controlled by the operation. The main goal of the ESG is to control your hunger so you can be successful in losing weight. Losing about 20% of your total body weight is associated with dramatic improvements of both quality of life and medical conditions. You can see medical conditions like early diabetes, sleep apnea, joint pain. All of those things can resolve with that degree of weight loss. In addition, just the quality of life is better. We often hear our patients say, I have more energy. I'm able to sleep at night. My partner is able to sleep at night because I'm not snoring. These are just great advances that are associated with this kind of weight loss, which we don't usually see with medical interventions. Why might you choose to have a procedure done here at Perham Doctors Hospital with myself, Dr. Brengman, and Dr. Aquilina? Well, first of all, we're the leader in our region for weight loss surgery and weight loss procedures. We've done many procedures over the 25 years of practice, including many endoluminal procedures. So this is not really a new territory for us. But more importantly, we have an amazing team of dietitians, nurse practitioners, and physician's assistants that are going to work together to talk about your problem, devise a plan, and help you succeed. Last year at Parham Doctors Hospital, we performed over 500 bariatric procedures. Since the program inception in 2013, we're up to almost 4,000 procedures. That kind of experience gives us a team in the hospital that both knows this disease process and how to care for you and to get you back on your feet sooner. If you find that what you've heard today about this video of ESG or any of our other information on bariatric procedure resonates with you and you want to meet those goals, please reach out to us. We'd be happy to see you at any time.